Medical versus educational models. When parents take their child to a doctor or therapist and have a medical or psychological evaluation done for their child, recommendations are made to benefit the child. Doctors often make recommendations for medical or therapeutic services to benefit the child, as well as suggestions for school services. There are occasions when medical doctors suggest that families request a 504 plan or an IEP from their child's school. Schools have an obligation to consider information from outside providers, but are not required to follow those recommendations. Doctors, therapists, and other therapeutic professionals make recommendations for private therapy and medical treatments, but cannot determine if a child qualifies for an IEP or 504 plan or decide what services should be included in a student's plan. It is helpful to understand that sometimes the difference between medical and educational recommendations for the same student is due to different standards and obligations, not because of wrong data or bad intent. The medical recommendations that are made by doctors and therapists are always going to aim for the maximum growth, but could be limited by insurance approval. The school IEP team is obligated to provide students with disabilities with a free and appropriate public education. The medical team determines the focus, frequency, and duration of services. The IEP team determines the student's educational needs and what support is required. The medical team addresses medical conditions and works to get full potential recognized. The student's educational needs are determined individually by the IEP team. If parents disagree with the IEP team about the services included in a student's IEP, they can ask for an explanation of that decision in writing called prior written notice and consider using their other procedural safeguards. For more information, visit www.askresource.org.